Hi there. Chemotherapy, or chemo for short, is a type of medicine which treats cancer. Chemo goes into your blood and stops cancer cells from growing and spreading too quickly. You can have chemo in many ways, but today I'm going to show you the most common, which is an intravenous infusion. Intravenous means into your veins, and it's a way of getting medicine and other liquids into your blood. When you have chemo, your grown-up will always be with you. Say hello to your oncologist. Tap on them to find out more. Your oncologist will choose your treatment plan and how much chemo you need. It's a tricky decision, but they are experts and know how best to care for you. The oncologist or nurse will explain everything about chemo, and you can ask as many questions as you want. The length of time needed for chemo is different for everybody. Treatment is often given in rounds, which gives the medicine a chance to work in your body. When you first start chemo, you and your grown-up might stay in hospital or in a nearby hostel. There are different ways you can have intravenous chemo. These are some of the most common. Tap on them to find out more. The way you have chemo depends on how much you need and how often you need it. There is no right or wrong way. Your oncologist will decide what's best for you. Say hello to the nurse who will take care of you. Tap on them to find out more. The nurse makes sure everything is clean before chemotherapy. The cleaning liquid can have a strong smell. That just means it's doing its job. When you're having chemo, it's important to be extra clean. Your nurse will tell you how to watch as I have an infusion. When I have a chemo infusion, it's important to feel comfortable. The nurses will give me medicines to help with sickness. I can choose to sit on a chair or on a bed. It's up to me. If I want to drink, an infusion is when medicine is attached to a line and it gradually enters my infusion bag. Burette. A burette. The infusion medicine is in a clear pouch or a device called a burette. The chemo nurse will check that my line is clear and free-flowing. If it isn't, the nurse cleans my line by attaching a syringe of salty water to it. They pull back on the syringe until they see a drop of blood in the tube. This is called aspirating, and the blood is called a flash. Next, the nurse hangs the medicine on an infusion stand and attaches a pump to my line, which helps the chemo move into my body. Some people get a funny taste in their mouth during chemo. Sometimes it's salty, sometimes it's metallic. My nurse might have something to help with the taste if I need it. Ice cubes or flavored ice can help. How long my infusion takes depends on how much chemo I need and how my body accepts it. Ask your nurse or oncologist how long your infusion will take. If your infusion stand has wheels like mine, you can move around the room. But ask a nurse first. It's also okay to sleep during your chemo, if you want to. During chemotherapy, my grown-up will always be with me, and there will be nurses close by. If I feel uncomfortable or worried, I will tell them and they will help me. Chemotherapy can have side effects. Most people don't have all of them, and everybody reacts differently. Ask your nurse to talk to you about side effects and what you can do about them. An infusion can take some time, so bring something to keep you entertained. Maybe a book or a toy or something. Choose something fun. That's everything I can tell you about chemotherapy today. If you have any more questions, ask your grown-up or your medical team. They will be happy to help you. Bye for now.